Welcome to Week 3 presentation on infectious and parasitic diseases. This chapter covers the codes A00 to B99. This is Dr. Regina Glenn, and I will be hosting this presentation. This chapter is for conditions that are easily communicable. They may have a single code assignment, such as B37.1 for candidiasis of the lung, or may have multiple code assignments, such as N30.20 and B96.20 for chronic cystitis due to E. coli. When coding a systemic infection, it is important to determine the level of infection based on the physician documentation. A systemic infection may begin with bacteremia. This is where there is the presence of bacteria in the blood. However, it is not affecting the patient. The next stage is septicemia or sepsis, when the bacteria are causing systemic symptoms, such as fever. Severe sepsis occurs when the body organs, such as the kidneys, are being affected. Septic shock is circulatory failure associated with severe sepsis. Septic shock requires the use of at least two codes. One code for the systemic condition and the second code for the septic shock. Many bacterial infections are resistant to current antibiotics. It is necessary to identify all infection documented as antibiotic resistant. Assign code Z16, infection with drug resistance microorganism, following the infection code for these cases. Code only confirmed cases of HIV infections. This is an exception to the general coding guidelines. The physician's statement that the patient is HIV positive or has HIV-related disease is required. Z21 is used when a patient without any documentation of symptoms is listed as HIV positive or known HIV. Do not use this code if the term AIDS is used or if the patient is or has been treated for any HIV-related conditions. AIDS is sequenced as the principal diagnosis with additional codes for the related conditions. AIDS is sequenced as a secondary when patients are admitted for an unrelated condition such as an injury. AIDS is sequenced as a secondary code when chapter rules govern such as in pregnancy. This is the end of the presentation on infectious and parasitic diseases. If you have any questions, please contact your instructor.